Hey, welcome back to Offend You. I'm Michael Vaughn. One of the top stories today in Idaho is the Idaho Medicaid expansion bill that we voted on this last election and passed, and I believe it's like 60 or 70% voted for it. So, so what I'm trying to understand here while I'm reading this is if they already had us vote on it, I thought they would have the bill ready. Weren't they supposed to have the bill ready before we vote on it? Instead of having us vote on it and then do changes? I might be wrong. It just seems a little odd. Anyways. So, this is in Boise. And the title is Here Are the Ways Idaho's Medicaid Expansion Bill Might Break the Law. And this is by Audrey Dutton from the Idaho Statesman. Let me be clear. I'm just reading the news to you guys. I'm not a journalist. I'm not on the ground doing anything, at least not yet. But just right now, I just want you to know that these people, please check out the articles yourselves. Alright, let's continue and read. Alright, during a House Health and Welfare Committee hearing on Medicaid expansion earlier this month, both resident Denna Duncan listed a few of the controversial ideas the Idaho legislator had put forward: work requirements, patient copays, and more. Are these things even legal? She asked. Idaho Medicaid expansion bill with several sideboards such as work requirements was signed by Governor Brad Little on Tuesday. Lawyers told Idaho Statesman that it might contain illegal provisions. If it was illegal, why'd they sign it? More than 60% of voters in November approved the law giving Medicaid to all low-income adults in Idaho. Instead of funding the expansion outright or repealing it, Republicans in the Idaho legislature spent much of the 2019 session finding ways to change it. Various bills ping-ponged back and forth between the House and Senate, and lawmakers came up with new ideas on the fly. They gave conflicting statements on whether they meant to leave out a job training program they had said was important. Nobody seemed to agree on how much the various proposals would cost the state. When it comes to the major piece of the bill, the courts might have rendered the question moot. A federal judge last month issued a ruling against work requirements in two other states, Kentucky and Arkansas. The judge said that the Trump administration didn't adequately consider how those requirements would affect health for the poor before approving them. Observers think that they could have a chilling effect on similar proposals. The main thing to take away from the Arkansas and Kentucky decisions is that coverage matters, said Catherine McKee, senior attorney at the National Health Law Program, which helped to bring the lawsuits over work requirement in those states. Okay. Thank you, Miss Catherine McKee, bringing the attention. Hacking and thrashing in legislature. Man, this is really opinionated article. Idaho would have to get federal approval for most of its bill's provisions. That isn't guaranteed, but the Trump administration has shown it is eager to sign off on big changes to state Medicaid programs. They've kind of tipped their hand, and they're anxious to have people come in and seek waivers. But I think, as a systematic matter, they have gotten the procedures in place to ensure that they're going to be evaluated in an even-handed manner, said Jim Jones, an attorney with Parsons, Bilhey, and Latimer, and the former Chief Justice of the Idaho Supreme Court. Sorry if I got the name wrong. To defend adding special rules to Medicaid, you better have a case that you can make, Jones said. And I think we will probably run into the same difficulty. Here we are, hacking and thrashing in the legislature. Let's do this, let's do that. And it doesn't seem to be a fact-based procedure. And I think when the dust settles, there's going to have to be a pretty good showing that it's not going to impede people from having coverage, and it's not going to keep people from getting service. Because that's what's going on right now. There's a lot of us that just fit into that gray area where we can't, like me, I'm too poor to have health insurance, but I make just a couple dollars, or I have a couple dollars over, so now I'm too rich or something. And there's this gray area that a lot of people fall under, and nobody even knows they exist because there's no. Maybe I'm wrong, but I haven't seen any data. I should look into that. There probably is data. I shouldn't be saying that. Anyways, let's go on. Can expanded Medicaid be used as a jobs program? The bill says Idahoans on expanded Medicaid have to spend a certain amount of time every month working, volunteering, studying, or learning a new job skill. Bitch, what? Okay, I understand that. Okay, here's the problem with this. They're trying to target people that are trying to cheat the system. And I understand that. A lot of people cheat the system. But you know what sucks? People like me that I want to work. That's why I'm doing YouTube. Yeah, I can't. I mean, if I squeeze my hands too hard or overexert myself, I will be in bed for like 3 days because I'm exhausted and in pain. Like, it's just stupid. So you're telling me that in order to get Medicaid, I have to spend time working or volunteering? Are you kidding? So how does that help the people that can't do that? Huh? What, you just say screw them? This mandate, dubbed a work requirement, is the most controversial part of the bill. Well, yeah. Because it just feels like all they're doing is just trying to target people to penalize them. This goes back to, it's just all about the money. Okay, let's move on. Its supporters say people shouldn't rely on government assistance if they don't need it. I agree. They also contend that the Medicaid work requirement is a path out of poverty. Yes, for people that are healthy enough to work, it is. I agree. But there's a huge part of the state that has people like me that fall in the gray area, and we can't do anything. So anyways, they also contend that Medicaid work requirement is a path out of poverty, although lawmakers remove a job training program from the final version of the bill. Why the hell would you make it a requirement to work if you're not going to train those people you want to work just so they can get health coverage? Are you hearing this? Like, opponents see it as another hurdle, keeping poor Idahoans from getting medical care. Yes. Most Idahoans who qualify for expanded Medicaid already work or would be exempt from the bill's work quotas. The bill just forces people to jump through bureaucratic hoops, they argue, and I'd argue the same. It's bullshit. That's all it is. They should have had this shit done before we voted on it. But maybe I'm wrong with how they operate, but damn. So we vote for a bill and then they can just go in and change it and like totally 180 if they want, and say because we voted for it. Yeah, fuck. All right. Now check this out. Anyone who doesn't comply with the work requirement faces 2 possible penalties. Let me say that again. Faces 2 possible penalties. Losing Medicaid or having to pay for medical care. See that? That's what government loves to do. They love to make a criminal out of people. Okay, you can call it what you want. Banning, penalty, tax, whatever. It's theft. And it's ridiculous. The bill says its first choice is to kick people off Medicaid for at least 2 months. But if a court deems that illegal or the federal government doesn't approve it, then non-compliant Idahoans will be charged a copay when they seek medical care. Like, does it? I don't know. To you, does it just seem like it doesn't matter if it's left or right? They just want to screw us with our medical crap. Like, I don't. Either they're really trying to fix it and they're just making it worse, or they really don't give a shit and and I don't know. It's really frustrating, you know. And the National Health, the National Health Law Program argues that work requirements are just plain illegal. Thank you. The court ruling against the work requirements in Arkansas was more nuanced than that, but it might have the same effect, halting the move toward work requirements in states like Idaho. If the Idaho plan does not get a green light from federal regulators, that leaves the question of whether it's legal to kick people off Medicaid or whether it's legal to charge a copay. It shouldn't be legal for the government to force you to pay money just so you can go get medical help. What is wrong with the world? The copay piece was presented as a more gentle penalty. Excuse me? Let me repeat that. The copay piece was presented as a more gentle penalty. Right. Because everybody likes to get screwed gently. But McKee and it's still iffy. But McKee said it's still iffy. There are legal limits on how much Medicaid patients can be asked to pay, and some patients can't be asked to pay anything, she said, and I agree. There's another potential hurdle there, she said. Just imposing heightened cost sharing on this population itself may not be permissible. Jones concurred. I think that the state would have to prove that it's not an impediment to delivery of the health care to these qualified people, he said. Free to choose your doctor. The bill would put Medicaid expansion into a more closely managed system, kind of like an HMO. Patients would have a medical home, such as a primary care clinic. Medical homes are increasingly popular because they give patients one place to go for their health care, instead of drifting from doctor to doctor, which is so common. The Medicaid Sideboards bill adds an extra layer, though. If a woman wanted family planning services, such as a prescription for birth control pills, she'd have to go through that healthcare provider. She could see an outside gynecologist, but only with a referral. She couldn't just pick a woman's health clinic and go there without her primary doctor's approval. Do you see where all this is going? And trust me, when we get more into the opioid stuff, we're really going to delve into how it is becoming a collar around patients' necks, and the doctor and the pharmaceutical companies have this leash, but we'll get into that in other videos. But do you hear that? You can't go to another clinic unless you get approval from your doctor? What? Okay. Like, I really want to go off on a tangent right now. It's just bad and terrible policy to require someone to get a referral for family planning services, McKee said. It's bad and terrible policy for anything. I don't need a doctor's permission to go see another damn doctor. Because, of course, they're going to be like, well, especially if they want to keep bringing you in for money, they're going to keep you. But do you know what it cost? You'd have to make an appointment. You'd have to go make your copay. You'd have to see the doctor. Then you'd have to get a bill just to get the referral to go see the other doctor. Trust me, this is what happens. Also, it might run afoul of federal law, she said. Medicaid is the insurer for so many women of childbearing age that the federal government has special rules for family planning services and supplies. It requires state Medicaid programs to cover them, and it forbids states from making them hard to access. The National Family Planning and Reproductive Health Association penned a memo on this topic a few years ago. The right to freely choose to receive family planning services from any qualified participating Medicaid provider is an essential protection designed to ensure that Medicaid beneficiaries have ready access to health services they need when they need them, and from a provider they trust, the association wrote. Federal law guarantees that Medicaid beneficiaries can receive family planning services from any qualified Medicaid provider. This principle is referred to as freedom of choice. Let's just get one thing straight. The only reason that these people are penning this right now is because abortion clinics, Planned Parenthood, stuff like that. Which, don't get me wrong, not all of it is. I shouldn't generalize that everybody that visit these are getting abortions. That's not what I'm saying. I'm just saying that it's a moneymaker for these people, and they try to push it. Now that we get that out of the way, I do agree with them. You should have the right, to choose whoever the hell you want to go see. So don't get this wrong. The National Family Planning and Reproductive Health Association, their intent is wrong, but I agree with their language. According to a federal manual for state Medicaid programs, a Medicaid HMO program cannot require a referral for a patient to get family planning services or supplies outside the HMO. Instead, patients are allowed to choose any qualified provider, it says. What's more, if a woman failed to comply with the bill's work requirements, she couldn't be penalized with a copay. Medicaid enrollees may not be charged cost sharing for family planning services and are given freedom of choice of provider. And when it comes to family planning, the Kaiser Family Foundation wrote in a comprehensive 2017 report on how changes like those approved by the Idaho legislature affect family planning. So private insurance or Medicaid. Another piece of the bill would put people on private health insurance through the Your Health Idaho exchange by default. If someone wanted Medicaid coverage instead, they could opt in. The carve-out would apply only to people with incomes between 100 and 138% of poverty level, which equals to $12,490 to $17,236 for a single person. And I know this because there was a time when I just made $17,000 and then like a couple hundred over one time, and I just couldn't believe that a couple dollars would keep me from getting health care. And as far as I understand, I haven't read this bill in its entirety, but from what I understand of it, personally, I actually get covered now. So I like that we got this bill approved, but it's starting to piss me off that I don't understand why these conservatives in this state want the government to regulate everything. I don't know. I just don't get it. And maybe it's not them. Maybe there's liberals that are fighting it too. Who knows? The state, I don't know if you noticed in this last election, the state had a possibility of flipping. I know people say, no, that's not possible, but you give it 20, 30 years, I see the state flipping. Conservatives don't get their shit together. All right. It's a lighter version of the Utah's bridge expansion, a federally approved plan to expand Medicaid in Utah only up to the poverty line, leaving people who are slightly above the poverty out of Medicaid, but allowing them to get private insurance on Utah's exchange. And see, that's what I didn't have. See, I was just slightly above, and I was just screwed. I had to file bankruptcy because of my medical crap. I mean, it can destroy everything with how much medical, just seeing a doctor, testing. If you don't have health insurance and you don't have a choice, I mean, it is debilitating financially, mentally, physically, especially with the autoimmune. All right. Anyways, that's where I kind of fell. So supporters said Idaho's carve out would save Idaho money. since those people would be getting insurance paid for by federal tax credits. It would let people who currently have private insurance through the exchange to keep those plans. Opponents pointed out to the difference between private insurance and Medicaid, including the type of services covered and the difference in out-of-pocket cost. As lawmakers debated this piece of bill, they raised questions on how Idaho would implement this rule. Would a whole new insurance plan have to be crafted for the exchange? Would the federal government impose conditions such as funding cuts that came with Utah's waiver? With so many unanswered questions and with the legislation still up in the air, when the statesman interviewed her Friday, McKee couldn't opine on Idaho's proposal, but she said her organization doesn't support partial expansions. Thank you. Yeah, because we voted for the whole damn thing. We didn't vote for partial and all this other crap they're trying to cram in there. We certainly advocate for Medicaid expansion up to the full 138% of federal poverty level income, McKee said. That's what Congress designed. That's what they decided makes sense for that population. And listen, I agree. We shouldn't have partial shit. We voted on the whole thing. And any lawmaker that's trying to change anything after we have voted, screw you, man. And I could be wrong. That might be the way they do it. They might let people vote on X bill, and then they'll just go in and argue and change it and screw the constituents. But I don't know. Maybe I'm wrong. All right, thank you. Please like, subscribe, share. Also, you can follow me on Gab, Minds.com, Twitter, Facebook, YouTube, BitChute. Just look for Offend You. All right, thank you for watching.